I have on my standard precautions. I'm going to make sure that the scene is safe. I'm going to assess for the mechanism of injury, count the number of patients, call for additional help. I'm going to have my assistant take C-spinal mobilization. I'm going to approach the patient. I'm going to verbalize my general impression. I'm going to assess for level of consciousness. Sir, can you hear me? He doesn't respond. I'm going to apply noxious stimuli and he moans. Therefore, he's responsive to painful stimuli. At this point, I'm going to have my assistant open his airway using the modified jaw thrust technique. I'm going to assess his respiration, his rate, rhythm, depth, quality, expose his chest, and assess for any airway injuries. I'm going to have high flow oxygen applied via non-rebreather mask or bag valve mask as appropriate to assure adequate ventilations. I'm going to assess for any life-threatening hemorrhage. I'm going to assess his pulse and his skin color, condition, and temperature. I'm going to assess for signs of shock. If I see signs of shock, I'm going to treat for signs of shock. I'm going to keep the patient warm. We'll keep him supine. I'm already administering high-flow oxygen, and this patient is going to be a rapid transport to the nearest appropriate trauma facility. At this point, prior to rapid transport, we're going to perform a rapid head-to-toe exam. I'm going to look at his scalp. I'm going to assess for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling. Look in his eyes, his nose, his mouth, his ears. I'm going to check the back of his spine, his cervical spine. I'm going to look at his neck, checking for trachea midline, jugular vein distension. At this point, I'm going to apply a cervical collar. I'm going to move down to his chest. I'm going to assess the sternum, the clavicles, equal rise and fall of the chest. I'm going to also take the chest in two locations. I'm going to move down to the abdomen. I'm going to palpate all four quadrants. I'm going to check the pelvis for stability, genitalia. I'm going to look at the lower extremities, checking for decap, BTLS, deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. I'm going to assess the upper extremities. We're going to log roll the patient on your count.
1, 2, 3.
We're going to log roll the patient. We're going to assess his posterior and his buttocks. And when we return him, we're going to log roll him back onto a spine board.
1, 2, 3.
At this point, we're going to secure the patient to the long spine board with spider straps, head blocks, C-collar, and we're going to provide rapid transport to the nearest trauma center. At this time, I'm going to perform going to get his vital signs, and before I leave, I'm going to get a sample history. I've already seen his signs and symptoms, his allergies, medications, past pertinent medical history, last oral intake, and the events leading up to the injury. We're going to assess his vital signs. We're going to check his blood pressure. Blood pressure is 130/80. I'm going to assess for pulse and respirations. Respirations are 18. Pulse is 110. At this point, I'm going to perform a detailed physical exam. I'm going to start back at his head. I'm assessing the scalp as best I can through the appropriate head blocks that are holding him. I'll look in his ears for any blood, cerebrospinal fluid. I'll look in his mouth. I'll look in his nose. I'll assess the eyes for equal round reactivity to light. I'm going to continue on down to the neck as I can assess through the C-collar for tracheal deviation and jugular vein distension as it is visible. I'm going to assess the clavicles, the sternum, the chest for equal rise and fall. I'm going to also take in between 4 and 6 locations, comparing side to side. I'm going to move down to the abdomen. I'm going to palpate all 4 quadrants. The pelvis is still stable. Genitalia. I'm going to assess the lower extremities. I'm going to assess for CSM, Circulation, sensation, and movement. As the patient is responsive only to pain, I can only assess for circulation. We'll do the same on this lower extremity, assessing the same. Upper extremities, checking for CSM. I can only check the posterior by reaching around and checking the voids, looking for any blood, but we've already done a good assessment of his posterior. At this point, we'll continue rapid transport to the nearest appropriate medical facility. We'll do an ongoing assessment where we will reassess any interventions, LOC, ABCs, and vital signs, and we'll do that every 5 minutes.